Hello, everyone. Hi, Becca. Welcome to the show. This is going to be a podcast specifically about long COVID, how to overcome long COVID, and it's going to have more advanced concepts that are for, especially for people who help others recover from long COVID from a mind-body perspective today. And we're so lucky to have Dr. Becca Kennedy with us. I'm going to read her bio. Dr. Becca Kennedy received her medical degree at the University of Michigan at Ann Arbor and completed her residency in family medicine at OHSU in Portland, Oregon. She worked as a primary care physician at Kaiser Permanente for 14 years, where for over a year she ran the long COVID specialty group. She recently left Kaiser to start her own practice at Resilience Healthcare, where she works with patients remotely throughout the world. You can find her online at resilience-healthcare.com. So Becca, thanks again for being here. Let's start on a personal note. I know that you have had some experiences with chronic symptoms yourself. Can you talk about how those affected you and your work?
Yeah, absolutely. I came to this work because of my patients and seeing so many problems we couldn't help for so many years, and was fortunate enough to find this work. And so that's what initially brought me to this work. But after I learned about this model and was doing this work, I then developed my own chronic symptoms from some stresses in my life and a lot of different things going on. But I developed chronic pain and fatigue that went on for quite a while and was a really interesting experience to go through of knowing consciously, rationally in my brain what was happening in my body very clearly, but it's still going on and happening automatically.
Yeah, and so I knew you at this time and we were talking and I remember you saying like I'm helping all these people with chronic pain, but now I have chronic pain, because you had not had an issue with this in the past. It was when you got into working with
Yeah,
people and helping them heal that this happened for you. So how did that affect you and
yeah.
did it affect how you worked with patients at the time?
Initially, it made me feel a little bit of fraud in some ways, that here I was having the symptoms, but helping other people get out of it, but not being able, well, not at the time, feeling like I wasn't helping myself. But then certainly later, you know, going through that experience has really not only solidified the work that I do, but also my ability to help people. And I think really get down to the details of how I interact with people and support them and help them and teach them is really transformed by having gone through that myself.
Yeah, it's making me think of I had an issue with chronic pain in my 20s that I overcame, and then I really haven't had a problem with chronic pain since then. But just recently, I had a bout of like very severe stomach pain. It lasted like 20 minutes. I don't know what it was, but I could not move. And I was like, oh, right, this is what really severe pain feels like. Like until you have
Yeah.
it, or if you haven't had it for a while, you can forget just how debilitating it can be. And for me, it really just reminded me of the compassion that's just at the core of working with chronic pain patients. It's just like how hard
Yeah.
it is
Right.
to live with this
Yeah,
every day.
absolutely. Yeah. When I was really deep in the thick of it, my symptoms were really quite bad at night and in the morning, which is very common and normal because our amygdala is turned on in the early morning just through the circadian rhythm, which is why the symptoms are bad at night and in the early morning. And there was this one morning in particular that I woke up and my whole body was on fire. And I just had so much pressure in my body and fatigue. And I felt like one of my patients once said, the feeling like you were injected with lead, which is exactly how I felt. And I knew 100% in my intellectual brain that this was brain signaling, my nervous system. I mean, without a shadow of a doubt. And I got out of bed and I literally could not raise my arm. It was, sort of at a 45-degree angle down. And as I tried to lift it, it was searing pain and pressure that was so bad. I literally could not lift my arm. And I even thought to myself, I know this is my brain. I'm going to do a little experiment with myself because I know
Hmm.
my body is not damaged. So I'm going to just try and lift my arm. And I literally could not do it. I mean, the pain and the pressure was so incredibly intense. Um, so, it was a really good experience for me to understand that. And but I did that, I went to self-compassion. I did some expressive writing. I did some meditation. I just sort of treated myself with kindness, and it was better throughout the day. And little by little over time, kind of working on all of these pieces got me out of that.
Yeah, I think it's so, I don't know, it's important to acknowledge things like that because I think some people get the wrong idea about a mind body treatment that it's like, oh, just know that your body's not damaged and it's healthy and the pain will just like
Yeah.
go away. It'll just dissipate. And of course, that strangely can happen occasionally, but it's much more
Yeah.
common that part, it seems like what you were doing is you were interrupting the catastrophizing and like the temptation that I'm sure you felt to medicalize it and go and get medical treatment when you knew you hadn't damaged your arm, you hadn't injured it, and that this is your brain, and there are all these signs to you that this is your brain doing it. Uh, but it didn't magically go away. You know, you kind of have to just
Right. Right.
start to calm
Exactly.
the nervous system and use the tools, and
Yeah.
over time it has its effect.
Yeah, exactly. And and it's neural pathways that are stuck in place. And yeah, it takes time to create new neural pathways, and get out of that.
Okay, so let's transition now to talking about long COVID. I feel like you are the person I know of that is a physician that has done the most work with long COVID patients and seen so many successes helping them recover. So, how did you get into doing that?
Well, I just have been so interested for years in really understanding all of these medical problems that we can't help very well in our medical system with being a family medicine physician now for 25 years. So for years, it just was an intense curiosity for me to find out new information about how we could really help people better. So I already knew that there was, which I think many physicians do, especially primary care physicians, because we really work with the whole person, that there was a connection between a lot of symptoms in the body, chronic symptoms with prior traumas, stresses, dangers we've gone through, what's happening with our mental health, that there's this whole connection, but a lot of mental health therapy doesn't necessarily help what's going on in the
Mm-hmm.
body. And so it just
Mm-hmm.
was this curiosity for me, and led to this years long search for this, and fortunately found this model. And so then when long COVID came about, it really made sense to me. And I thought, oh, this is it. This really makes sense. And because I was working at Kaiser Permanente Northwest, which is the Oregon, Washington region, which is huge, a lot of people. I became part of the long COVID clinic, and it was just maybe five different physicians that mainly did chart reviews from all of the primary care physicians from the whole region. So I started working in that, and really, I mean, assessed hundreds of patients with long COVID through this clinic. And then I started getting referred from the other clinicians, the patients that were the most severe, and so started using this model with them, and really seeing not only did it make sense, I mean, a lot of patients said to me, wow, this is actually the first thing a physician has said to me that actually makes sense. Or patients would say, I thought it was something about this. I knew it was my brain. I knew it was my nervous system, but just didn't know more. Didn't know how to articulate it more, understand it better, or, more importantly, didn't know what to do to get better. So I
Yeah.
so I just started working with patients using this model little by little, and really seeing people get better. And some many people that, again, just very, very, very severe. I mean, the most severe of the most severe, get better, and quickly just became inundated with hundreds of patients and, just trying to see everyone in every little way that I could over lunch and to really try and reach them.
That's great. And so we're going to get to the treatment process and like you talk about, it's a comprehensive treatment process. But first, let's linger here around how to know that somebody who has long COVID symptoms would make sense for this diagnostic process you go through with people. So,
Yeah.
so much biomedicalizing of long COVID people has been happening. There's assumptions by medical providers that if somebody has debilitating symptoms, they must have something structurally wrong with their body that's driving it. But then we also know that these major studies have come out showing that the typical long COVID patient has no major significant structural damage that they can find. There was a major study that came out from the NIH that showed that they're not really finding damage. So there's a lot of controversy and debate about this. And I wanted to ask you specifically, if somebody has long COVID and they've been told by their doctor it's being driven by micro blood clots, it's being driven by viral fragments, it has to do with the mitochondria, that's why they have fatigue or cytokine storms. Can you address that? Like, how do you work with people who are really convinced by what they've been told by well-meaning doctors?
Such an important question. And it's really, stepping back and looking at the whole picture. And again, being the lead of the long COVID clinic at Kaiser Permanente, assessing hundreds and hundreds of patients, is that there's, first of all, starting off with who are the people that have long COVID? And some of them had the acute COVID infection themselves. But even of those people, it actually wasn't even necessarily the people that had the most severe infection that were hospitalized. I mean,
Mm-hmm.
I actually had probably two patients out of my hundreds that maybe had some scarring in their lungs or some kind of issue like that because of a very severe COVID infection.
Right.
But the vast majority actually did not have a severe COVID infection in the first place. Some did, but many didn't, or some just barely had, very mild infection. Some developed symptoms right away. They just, they never got better and just continued on. But some actually got better, returned to their normal health for months even, and then developed the long COVID symptoms. But other patients actually just had the vaccine. They never even had the COVID infection in the first place.
Right.
And a pretty substantial number. And many of them, their symptoms started within hours. And other patients that had chronic symptoms before, for years before the pandemic, and those same chronic symptoms significantly worsened after the pandemic. So really stepping back and looking, and all with the same constellation of symptoms around the world. So
Mm-hmm.
so we look at that and say, well, if we think about viral particles or spike proteins or all of those sort of things, I mean, already it's not quite making sense. And then we step back even further, and this constellation of symptoms we have been seeing for not only years and decades, but really since the existence of humanity, and really goes along with PTSD, shell shock, fibromyalgia, chronic fatigue, and really this pattern of symptoms that we've seen for years. And that pattern of symptoms is really consistent with the nervous system in fight, flight, or freeze. So if we look at, just that piece of the information, but now let's look at the piece of the information like you're talking about with these biochemical changes. So there have been, so let me back up. Like you're saying, there has not been any studies to consistently show among, all long COVID patients that there is, one biochemical marker that they can really not only identify as the reason, but even more importantly, that we then can treat and help people with. They've found some different biochemical markers that are certainly more prevalent in people with long COVID than people without long COVID in
Right.
these studies, with cytokine changes, mitochondrial changes, serotonin levels, cortisol, the persistence of viral particles. I mean, that is found more in people that have long COVID than they don't. But it's also not found in everybody in the study. Not everybody in the study has these changes. And so then what about those people with long COVID? And, some of the thoughts are, well, there could be different things going on in different people. And really the tenet of medicine, what we are taught on practically day one of medical school is the simpler the answer, the better. It's that, for if there's all these different symptoms and we're trying to explain all the different symptoms in all these different ways with all these different diagnoses, that makes less sense than really stepping back and finding what's called a unifying diagnosis. And
Mm-hmm.
so, really looking at the nervous system and long COVID, that actually is the unifying diagnosis for all of these different symptoms. So, when we look at the nervous system, it's really about the nervous system sort of again being stuck in fight, flight, or freeze, which is dysfunction. I mean, it's where the brain is sending the body these signals that we need to be using all of our energy sources to protect ourselves from danger rather than be in the calm, safe, rest and digest mode, where in that mode, the brain signals to the body are telling the body, now use your energy to be healthy and repair itself, digest your sandwich, all of these different things. Whereas when it's up in the protect mode, it's just sending signals of, oh my gosh, do everything you possibly can to suck energy from everywhere to put it to the big muscles and your heart pumping and all of these things that evolutionarily were designed to fight a saber-toothed tiger or flee or freeze. And that was designed to be in that state very temporarily for 15 seconds or a minute, not for weeks and years. So, in that system is when there's all this dysfunction happening in the body. We know through biochemical studies, scientific studies, that when the nervous system is stuck in that mode, there's problems with the cytokines and problems with the mitochondria. The ATP energy stores are actually dysfunctional outside of the cell instead of inside of the cell. And serotonin can change, cortisol can change. So actually, we've known for a long time that there's a propensity to be in a hypercoagulable or create blood clots state because of what the nervous system is doing. Like that's been known for a long time. So, so changes can be found biochemically in the body, but the source of those changes is still from the nervous system being stuck in the on mode rather than in the calm mode. So again, even though there are these changes in the body, that's not the source of the symptoms, and it's not the source of how to get better. It's really getting to the root of why the nervous system is stuck in the on mode.
Yeah, let's stay here for a minute because this is the dominant, as far as I can tell, way that we're going about the mainstream medicine is treating people with long COVID, right? And you hear these
Yeah.
stories of, I hear people flying to Europe to get blood filtering and spending tens of thousands of dollars. Can you talk about what kinds of biomedical treatments you're seeing and if they're successful?
So the model that modern medicine follows and helps in lots of different ways is that when you have symptoms in the body, it's because of some sort of damage in the body. Often that there's a test that we can do that shows what that damage is. And then because of what that test shows, then we have some sort of specific treatment to address the damage in the body. Often a medicine or a procedure or whatever it is addressing that damage in the body. And that is
Right.
fantastically great when it is damage in the body. Thank goodness for modern medicine. So when there's an infection, when you have strep throat and you do the test and it shows strep throat and you have penicillin that can treat it, thank goodness you don't have to swallow razor blades anymore. Or if it's a broken bone and you do a test and you see that, or an infection someplace else, or diabetes or a thyroid problem or whatever it is, that model works great. Modern medicine is fantastic at that. But this paradigm, this shift is really understanding that symptoms in the body, real symptoms, me not being able to lift up my arm, are
Hmm.
happening because of the signaling in the brain, and that it is the primitive brain that only cares about staying alive on this planet. It has a bias towards danger that's misinterpreting signals that then get stuck in place. And so when we look at it from that perspective, there's no test that can show that. And so if we keep looking in the body for these tests, again, we can see these biochemical changes, um, like, a little bit more of a propensity for the blood clots or the cytokines. And so the problem is that when we look to treat that in the body, that's not the root of the problem. The root of the problem is the unconscious brain. It's the primitive brain, and it's how it's reacting to this threat. So I see patients all the time that we're trying to cram long COVID into our biomedical model that just doesn't work. It's not about damage in the body, so it's not about finding a test and then finding a pill or procedure to solve the problem. And because we keep, the medical industry keeps trying to look for a solution in the body, they keep trying to give medicines or procedures. And so I see patients all the time that have, just like you're saying, spent tens of thousands of dollars on trying to find a solution in the body, stellate ganglion blocks and triple anticoagulation therapy, lots of medicines. I think the newest thing I just heard is treating long COVID with metformin, which is a medicine for diabetes. Um, why that would help. But and just the hyperbaric oxygen chambers and red light therapy, all of these different things. I have patients that are on literally 100 supplements. So the mainstream doctors, I'm a mainstream doctor, um, generally uses prescription medicines and procedures, things like that. But naturopaths or functional doctors, they might be a little closer to the nervous system, but then often they just end up treating the body, but just in different ways with supplements or diets or, all these different things that also are not helpful. The, the problem I see is twofold. Number one is if you are trying to treat something in the body as if the body is damaged, number one, it's not effective. But number two, it really detracts from getting to the root of the problem that's in the nervous system. And it takes a while to really unwind kind of all of that information that, specialists have said and long COVID specialists at, top universities. And it's really hard to detangle all of that and really get to the point of really understanding the root in the nervous system. But the second one, and really concerns me a lot, I lay awake at night about this, is that some of those treatments can be specifically harmful. And to be on a
Yes.
triple anticoagulant, I mean, we often don't use that even to treat like a stroke or a heart attack where there are blood clots causing the problem. We often don't use a triple therapy, and that thins the blood and can be dangerous. It's, we often talk about when people are on the anticoagulant, like to be careful and not fall and hit your head because you could bleed. And so it really concerns me about doing therapies and trying things that there is not scientific evidence to show the benefit. Those studies have not been done, and and again potentially could be harmful. I get it. People are desperate. I completely understand that, and they want to try anything. And I would try anything if I didn't know what to do it. And I completely understand that. And I think that that's why it's so critical that we really get information out there about this model. And again, it's really about seeing people get better, person after person after person, not only in my own experience with working with hundreds of people, but other people around the world that do this work. As there's been studies on this that we can go into as well.
Yeah, we'll get to the studies. Well, as you were talking about all the testing that people do and doctors having the most advanced tests and expensive tests and something, I was just thinking about there is a really good test that you do with people that they call the fit criteria to determine whether a symptom is functional, whether it's inconsistent, or whether it's triggered. And no doctor is bragging about being able to do that test, as far as I know. But it's something a patient can learn. Any patient can learn this to do this for themselves, and I use it in my own life. Whenever I have some new symptom, it doesn't happen often, but occasionally I'll start to get a pain, and I'll use the fit criteria and be like, oh no, I think I'm okay. I don't think I need to get a checkup on this. I think it'll probably just fade. This source of pain will fade away in a few days. So what is this advanced test that we do for people with long COVID? We don't automatically assume everyone with long COVID has a biopsychosocial thing driving it, or a mind-body thing, or what we call neural pathways causing their long COVID. We test them. So what kinds of testing do you do?
Oh gosh, such a great question. So in medicine, as a physician, we have to make the appropriate diagnosis. And the way that we make a diagnosis, it actually mainly, I think a lot of people don't understand this. We are taught in medical school that, something like 80% of how we make a diagnosis is actually based on history. Might even be more than that. And then another 10%, 15% is based on the exam. So the history and the exam gives us the correct diagnosis in 85, 90% of the time. Testing actually only is needed to be done for a smaller part of making a diagnosis. That's really not the main way that we diagnose, because we have to look at the pattern of symptoms. And we start out with what we call a differential diagnosis. So if someone comes in and they're really thirsty and they're tired and they're urinating a lot, we have a differential diagnosis of the possibilities. And it could be diabetes, and it could be, other hormonal problem, or it could be, like all these different things. And we get a history, and we look at the pattern of the symptoms. And based on the pattern of the symptoms, we can often then rule out a lot of different diagnoses on the differential. And then we get down to then doing the testing. So then we test the blood, or we do an x-ray or a CAT scan or whatever we need to do for the particular situation. So with long COVID, that's something that's what we call a diagnosis of exclusion, which means there isn't a specific test that we can do to rule it in and say specifically, definitively, this is the diagnosis, like we can with diabetes. So what we do for diagnoses of exclusion is we look at the pattern, and then we rule out other things with the testing we can do, and then we're left with the pattern. So it is very important when someone has long COVID, they do need a medical evaluation by a physician. And I really can't stress that
Yes.
enough. Is it in my work at the long COVID clinic and at Kaiser, sometimes we actually did find undiagnosed diabetes or a
Right.
thyroid problem. I mean, very, very rarely, but sometimes that was there. And it is absolutely critical that you have the testing done to rule those things out. But that testing is not that complicated. It's relatively simple blood tests. And then if there's other symptoms, x-rays or maybe a CAT scan, maybe an MRI. But it's relatively simple testing. When you do that testing, and together look at the pattern, that's what can really get to the point of making the diagnosis. So what the fit criteria is really about looking at the pattern, and it's functional, inconsistent, or triggers. And it's things like, did the symptoms just kind of come out of the blue? I mean, with long COVID, sometimes it happens after the vaccine or after the illness, but say the illness got better and then started again. Well, what was that gap? Like, it kind of came out of the blue that you didn't acutely have an infection, you just started having the symptoms. And it's also patterns like, do the symptoms come and go or move around? Are they in different parts of the body that do not follow the known nerve pathways? Are they better at some times of the day, worse at others? Are they worse at night or in the morning when the amygdala is turned on? And that's a very typical pattern. Are there are they triggered by stress? Are they worse with stress and better when you're not stressed and having a good time? And it's not that you have to have every single one of these in order to then
Right.
say this is the nervous system. I mean, sometimes the symptoms are absolutely constant, no worse with stress, no better with having a good time. Sometimes that's the play or the case because the neural pathways are stuck in place. But if you are noticing inconsistencies, that really is goes along with the nervous system. I use the example of a sprained ankle. I think is really helpful because most of us have sprained our ankles, and that is damage in the body. And that follows a predictable linear pathway. Is when you sprain your ankle, you tear the soft tissues. Your body has to repair itself. And that follows a linear path. It gets a little bit better as you're off of it in a predictable way. If you go and you walk a mile, it's going to worsen, but then you get back off of it and it gets better again, and it takes, a few weeks, couple months, whatever it is, and it heals. When it's the nervous system, it doesn't follow that linear pattern. Sometimes the symptoms are really bad, sometimes they're a little better. You might have a little period where you're feeling great, a day, a week, 10 months, and then they come back. So that inconsistency is really consistent with the neural pathway in the nervous system.
A lot of people with long COVID, they have additional diagnoses or concerns. So I know common ones are, say, Epstein-Barr, mold, and chronic Lyme. Those are a few that we often see a lot that either go along with, or you can have the same symptoms driven by mold, driven by Lyme, driven by Epstein-Barr, as you've been told by doctors. How do you think about that?
I see this very, very commonly and often sort of in the naturopath world or functional medicine world is that there's other tests like what you just described that are done with patients, and a lot of patients come to me saying that they were diagnosed with these things with, abnormal tests. Sort of outside of the traditional medical world, again, they're often still looking in the body for the answers, and so doing this other set of tests. And when we look at the accuracy of tests in general, there's lots of tests that can be done that actually don't give accurate information. There's what we call false positives, which means that the test can show that there's something there, or it's an abnormal test, but it's actually falsely abnormal, that it doesn't actually represent what's going on in the body. And that's and and the testing that's done sort of in the traditional medical world, generally speaking, are rigorously tested with the scientific method to really accurately define if that is an accurate test or not. And so with chronic Lyme, for instance, there have been lots of studies in the scientific community really looking at the testing for Lyme and if that truly represents what's going on in the body. And over, they have not been able to find that these tests accurately represent what's going on. And in the testing, they've tried to treat with antibiotics and have just found that it was not helpful. It didn't get someone to the point of being effectively treated. And the modern medical world wants to have a test that's abnormal and wants to be able to treat with an antibiotic. I want to be able to treat with an antibiotic and a pill and get someone better. I will be the first person to prescribe that pill if it is helpful. But after 20, 25 years in medicine, it's just that there's a lot of things that aren't helpful. So a lot of the testing that's done is just not accurate testing. Like with chronic Lyme, a lot of those tests look at antibodies, which is the body's immune response to a
Right.
pathogen, not the actual pathogen. And once we create those antibodies, they can stay in our system, and there's lots of different ones, and whether it's an acute reaction or it's been there for a long time. And so those tests can be interpreted in a way that it can be positive, and it can be interpreted in a way like that is what's going on, and then given meaning that that's the reason for the symptoms when it's really not. And the same thing with Epstein-Barr, um, and with mold. And again, I see a lot of patients that have these abnormal tests, but really if those that actual test is accurate or not is I think a question. Um, so there's that part of it. But then again, if we really step back and look at the whole scenario, is there's many, many, many patients that get better. They restore their health to good health with this model of attending to the nervous system after they have been told that it was chronic Lyme or mold or reactivation of Epstein-Barr. They get better with this model. And so you take that piece together with there's lots of tests out there that are inaccurate tests, and kind of put that together, and really it doesn't make sense that the chronic Lyme or the mold toxicity or the reactivation of Epstein-Barr is the reason for the symptoms. Now, is there a question that, when our nervous system is stuck in fight, flight, or freeze, one of the chemical changes in our body that does not function well is our immune system. Is when we should be spending
Right.
energy towards fighting a saber-toothed tiger, we actually don't care about long-term fighting off illnesses. So it's, again, very well known that our immune system gets depressed and it doesn't function well when we're stuck in that on mode. So, you know, things like Epstein-Barr, theoretically can be reactivated. Or maybe if we're exposed to mold, I mean, I live in the Pacific Northwest. I probably breathe in mold every single day from my house. But is your immune system not able to keep out that invader as well? That certainly could be going on. Um, when we restore our nervous system to the rest and digest and the immune system functioning properly, then those parts can, it also can theoretically, if that's going on, help those parts as well. I've seen many patients that, through their naturopath or functional doctor, again, have had this testing done, shown that they have these things, Epstein-Barr, mold, have all these treatments. Um, some of them get testing and show they don't have it anymore, but yet their symptoms are still going on. So again, it's really looking at all these different pieces.
Okay, so let's shift now into talking about, we've gone over the diagnostic process, the kinds of weeds you can get tangled into in the biomedical system, and then what the fit criteria looks like, evaluating for people to see if their symptoms are triggered, if they're inconsistent, if they arose without any injury, like for the people who got the vaccine, for example, they would fit into that category, who had never had a COVID infection but developed long COVID from the vaccine. So in terms of the treatment, it's often the case that people confuse this neural reprocessing therapy treatment or pain reprocessing therapy that goes by several other names as well, but as similar to CBT, cognitive behavioral therapy, or mindfulness-based stress reduction, or like positive thinking. And it's easy to misunderstand it as that. So can you talk about what is this comprehensive treatment for long COVID?
Yeah. And actually, I just want to say one quick thing about the other fit criteria that I didn't mention is the triggered part, I think is also important. And the triggered part is really that there's stimuli that wouldn't actually change anything in the body that worsen symptoms. So things like, computer screens or different foods or sounds or, something external to the body can trigger the symptoms, but doesn't make sense, or weather changes, it doesn't make sense that there again would be damage in the body. And again, is about a hypervigilant system that is overreacting to the stimuli that come in. So I just wanted to make that quick point.
Yeah.
But then, shifting to treatment. I mean, that's the important part. How do we get better? Like that's what we want to do and want to know. And yeah, I think there are, these sort of all these different pieces that, people maybe understand or think about, that sometimes is just part of it. And the way that I approach it is really stepping back and again looking comprehensively. And so even thinking about it in terms of kind of three steps. The first step is understanding the science. And that's key, is really understanding this is new science that understands the primitive brain, the unconscious brain that controls the body, tells the body what to do, and that signaling is the source of the symptom. So really understanding the science, and there's a lot of different pieces of that to understand. The second piece is really accepting the diagnosis for yourself and really understanding that for yourself, why this is not because of damage in the body, but because of the signaling from the brain. Really putting together all of the pieces to really understand what's going on for you, sort of the lifetime threat load that you've been through, kind of personality traits that are in place that I have all of, and how our brain takes that to the extreme. Exactly. Our brain takes it to the extreme and turns on the fear or danger mode. Um, Putting all of those pieces into place, as well as, that you had normal testing, that the fit criteria applies, putting all those pieces together so that it makes sense for you that the nervous system is the root of the problem. And then that's the second step. And then the third step are the tools. And there's comprehensive tools. If you start with the tools, but you're not accepting that the diagnosis is your nervous system and you still have one foot in the world that the problem is in the body, the tools are not going to help. So, and if you don't really understand the science, and you don't have to understand the science in all its depths, but also it's really hard to apply the tools really comprehensively. So it's really important to go through those steps. So now the tools. And really I look at the whole part of it. So the tools is really understanding our whole life and who we are as a person and what our primitive brain has been through throughout our whole entire life. Because our brain stores and remembers everything that happened that was dangerous. And then it applies that to the current moment. And it applies that from the primitive brain standpoint, which is not our rational brain. It doesn't make sense on the surface rationally, but it makes sense once you really understand how our brains work from the primitive perspective. And so really understanding that the things that happen to us throughout our life, it's like a bathtub that you fill up with the dangers and the stressors and the big traumas, little traumas. And as that bathtub fills up, if it hasn't gotten to the top, then we're doing okay. But then as we fill it more and more and it spills over, that's what then takes our nervous system into this mode. And so going into the pandemic, if you start with a lifetime threat load of water down at the bottom, and then you add the huge amount of trauma and stress of the pandemic, you're still below the surface. But if you're starting halfway up or pretty close to the surface, and then you add the huge trauma of the pandemic, then it spills over. So it's really understanding comprehensively what your life has been. So then, kind of looking more specifically, there's sort of the category of sort of stress management tools. Lots of things that people know about that calm the nervous system. Meditation, breathing, restorative sleep, social connection, being in nature, all of those things, those are great. Those are awesome. That can calm your nervous system. But if I often use the analogy of if there's a 3-year-old that's afraid that there's a monster in the closet, if the parent goes in and soothes that 3-year-old, their fear is going to dial down. It's awesome. But if the parent leaves and you don't teach the 3-year-old that monsters don't really exist, the fear is just going to go right back up. And that's what all those tools are. So they're very important and helpful, but it's really important to understand them for what they are. And they're often not enough by themselves. So many patients come to me and say, I get that this is the nervous system, but I've been meditating 2 hours a day and I treat myself kindly. I meet with my friends, I sleep, sleep, whatever it is, but I'm still having these symptoms. And then that actually really increases the frustration and questions whether or not this is really a nervous system problem. But those tools are not enough by themselves, although important. So then let's look at the other tools. How do you open the closet door and walk in there and teach that 3-year-old that monsters don't really exist? And one part of it is how you mentioned the pain reprocessing therapy, or I call it neural reprocessing therapy because I use it for lots of different symptoms, not just pain.
Right.
Dizziness, shortness of breath, itching, brain zaps, zaps in the body, tingling, numbness, whatever it is, anxiety. So that's one tool. And sometimes I find that that tool also is blown out of proportion of how much benefit it can have. And that tool is, that's a whole nother discussion, but essentially, how do you rewire that pathway that's stuck in place? It's sort of like exposure therapy of kind of using your body or paying attention to your symptoms, but coupling it with safe signals to teach your brain that there isn't really danger there. And doing that as a process over time can slowly teach the brain it doesn't need to send this warning signal. You don't actually need the warning signal. So it ultimately can turn down. The process, or, again, it's a process. It's not that you tell yourself safe signals and then you turn the symptoms off in the moment. That's not what it is. It's that as you do it over time, you eventually get there. But that's one tool. Um, Another part is the emotional work. And this is the part that when I first learned about this model, this did not make sense to me. And I was like, what? I mean, it really was so much cognitive dissonance for me. I could not understand it. And I put it over here and I focused on the neural reprocessing therapy, meditation, breathing, understand the body's not broken, like all these different parts. And now I've come 180 degrees. And I find that the emotional part and doing the emotional work is really important for most people. Not everybody, for sure, but most people. And I would say that most people don't think it's necessary. They don't realize it because of how our brain and our psychology works. And this is the part that I actually work one-on-one with my patients mostly on, because often they've done all these different things and haven't gotten better. And I really find the emotional part is the most important part. And really kind of, it's a whole, again, longer conversation, but essentially in a
Let's linger
nutshell.
here for
Oh,
a second, because this is my
yeah, yeah,
experience as a coach for people with mind body health issues. Is I noticed that a lot of them find me and they've like actually done a great job of accepting of like using the fit criteria on their own to be like, okay, I know when my back pain moves to my hip and then it moves back to my back, or the symptoms spread around, or they switch off on the weekend. I know this is a mind body problem, but
yeah,
I'm still having a lot of
yeah,
symptoms. I've tried the meditation, I've tried the smack tracking, and I'm not getting better. And I feel like for not everybody, but the majority of people like that, they need help. They need another person to help guide them towards like what I would say is a mind body insight related to emotions, related to their
yeah,
histories, related to
right.
trauma. And that, I mean, that kind of work can take a long time too. That's the other thing, is like we've lived decades of our emotional lives. We've accumulated all these different wounds of various sizes of trying to relate to people, trying to um,
Yeah,
survive.
yeah,
And
right.
many people have been to therapy, but most therapists do not know anything about how to link a psychological trauma to a physical manifestation of stress.
Yeah,
Unfortunately, many do, but most people that I see have not
some.
been able to meet with a therapist like that. So,
Yeah.
can you just go into some more detail, and maybe if you have like an example of somebody with long COVID who thought they had kind of processed all their emotional things, and then when you worked with them, you were like, oh, what about this?
Yeah. Yeah, that happens all the time. And that's such a good point. Actually, that's what brought me to this field in the first place as a family medicine physician is really identifying that the problem with the symptoms in the body, the body keeps the score, is, sort of the emotions and the history and all of these things. But very, very typically, sending someone to mental health actually didn't help. And it's
Right.
not that it didn't help with anything, but they just patients come back over and over and over with physical symptoms. And we say as a doctor, no, we're not finding anything, go to mental health, but the mental health doesn't help. And it was this
Yeah.
chasm that so many people are caught in between the medical world and the mental health world, and very few people are bridging that world. And so that's what I came to this work with to do, is to be that bridge. And just like you're saying, I think that many people have done a lot of emotional work that has been helpful. Um, it's just that it wasn't linked to, hey, this is why you're having the symptoms in your body. And when we don't link that, often the symptoms don't resolve. But there's also a lot of therapy that doesn't really get down to the emotions, and a lot of cognitive
Right.
behavioral therapy, which is the predominant therapy, can help with some things for sure, but really doesn't get deep down into that sort of emotional work. And so over and over, and I do see patients who have had, decades of therapy that it just didn't get to the correct part. And when I
Hmm.
work with them with this, this different way of assessing it, often they do get better, even after decades of therapy. I mean, I have patients in their 70s, 80s, 90s with actually PTSD that have, again, had trauma-related therapy, emotional therapy, and it's just a different way to really resolve what's going on. But um,
I want to add
I,
real quickly, like I feel
yeah,
like a lot of psychotherapy, and I've tried many different kinds of psychotherapy, and a majority of it is usually not, even if it's emotion focused, you're talking about emotions, you're 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 describing this thing had an emotional effect on me, but you're not necessarily having an experience of the emotion and learning how to better facilitate the expression of sadness, the expression of anger, navigating how to express anger in a relationship in a way that feels safe and non-blaming. I find out I do a lot of work with communication, like how to talk about when you feel hurt by
yeah,
somebody, because so
yeah,
many people
right.
feel like the only way is to lash out and scream at somebody, and so they
Yes,
just hold it
right.
inside, and
Absolutely.
that
Hmm.
leads directly to chronic pain for the people I work with. It's like you can
Yeah,
trace it. It's like you had a conflict or an argument, and then your pain got worse. And it's very
right.
clear. And it's because
Yes.
they didn't know how angry they were, and they didn't know how to express that anger. And through working with somebody who's aware of the linkage between a symptom, a pain, or a fatigue, and its connection to conflict, and then expressing it, like speaking with anger in the voice, not just saying that hurt, but like really, embodying with the tone of your voice, with your animated in your body, how to speak and draw boundaries with people. These skills that have taken me years to learn. And when you impart those with people, I find that that can make a huge difference in people's chronic pain. So yeah, I think just to layer on to what you're saying, it's that people have been to emotion focused therapy, but they haven't actually been able to access anger and truly express it. Or if they haven't connected it with their pain. And sometimes you have to do things more than once, right? I mean,
Oh, a lot.
healing is
Yeah.
often about repetition.
Hmm.
And so maybe
Yeah.
you've touched this trauma once and expressed a feeling, but maybe if you do it again in a different context and a different point
Yeah.
in your life, you might unlock
Yeah.
healing in a different way than
Yeah.
you've been able to do before. So I always say you can't really underestimate the power of emotional work and working with trauma
Yeah.
with people.
Yeah.
And that's what I
Yeah.
found in working with people.
Yeah. No, right. Absolutely. And the way that I describe it to people of why this is the case, why our just normal psychology puts in what it puts in is that, we need social connection over here, but then we have self-agency over here, which is standing up for ourselves when we're not treated well. And when the two of them are in conflict, it's the most stressful thing really that a human being can go through. Because what do you give up? The social connection or the self-agency? They're both important. And most of us are not taught how to have both of them. And really, I think that's what this work is, just like you're talking about, is how do you stand up for yourself and feel the emotion that is normal and healthy and well deserved? How do you feel and release and let go of that so that then when you communicate with the person, that you can do that through compassion, but yet still standing up for your needs and not
Right.
have it lash out at that person because then it just never works. And so that's really the beauty of all of this. And really it's that our psyche learns that feeling and expressing anger, other emotions too, but I often find that anger is the biggest one, is dangerous. And the reason why it believes it's dangerous is that as a child, a human child cannot live on this planet by ourselves. We can't, we die if we don't have a caregiver or a parent. So we have to have that social connection. That is our lifeline. So if our caregiver and our parent doesn't treat us in the way that we deserve, then we're not gonna we're not gonna stand up for ourselves, let that anger in because it could break the social connection, which is our lifeline to literally living. And how we deserve as a child is to have unconditional love and a sense of safety. That's what we deserve. Do most people get that perfectly? Probably not. I don't know very many in this world, so it's hard to be human on this planet. Um, and so that we give up our self agency and we give up that it's safe to feel angry, to feel that emotion. So again, it's our primitive brain. It just wants to survive. So it learns that if we feel the emotion of anger, if we actually allow it into our conscious awareness and express it, we could potentially break that social connection, which is our lifeline, and we could die. So our primitive brain connects up feeling and expressing anger with dying. Like it really thinks that we will die. And our unconscious brain, it doesn't know time. And it holds on to every lesson it's learned that protects us. And it takes that through our whole entire life. It's not our rational brain, it's our primitive
Mm-hmm.
brain, our unconscious brain. And our brain can learn for lots of different reasons that it's not safe to feel and express anger. There might be someone in our life that it's really scary when they express anger, a parent, a other adult, maybe a
Yeah.
sibling, or we're taught specifically by our parents that it's not okay to express our emotions, or we're not taught a healthy way to deal with it, or whatever it is. I certainly, my brain learned that for various reasons. And so then we carry that with us. And the thing is that the emotion is still created because emotions are automatic from our unconscious brain. We do not rationally decide to create an emotion. So the emotion is still made, but when our unconscious brain has learned that it's dangerous to bring it to our conscious awareness, it just stuffs it down inside where it believes it's keeping us safe. And then our brain, the danger part of our brain, turns up to protect us, to keep this emotion safe. And the danger part of the brain is turned up. The emotion starts coming up, then the danger goes even up. And when the danger turns up, it sends the warning signals into the body. That can be the fatigue, pain, anxiety, depression,
Right.
whatever it is. But it's those warning signals that's stopping us from actually allowing that emotion up. So instead, this emotional awareness and expression therapy is, sort of one way that I find a really beautiful way to honor yourself, show your brain, like you're saying, actually feel the emotion and let it be heard, say and do whatever it wants. But you do it by yourself, alone, to show your unconscious brain, hey, look, not only is this not dangerous because I'm not going to hurt anybody by just feeling the emotion because I'm doing it by myself in a safe way, but I deserve to feel this emotion. I deserve to be treated well and really let it be heard. But then the important part is then getting over to other emotions, but getting to the compassion, self
Right.
compassion, and compassion for the other person or understanding, however you want to look at it. And that compassion and understanding for the other person and what they went through in their life is not about making excuses for what they did. No, we are saying, I deserve to feel this anger. But when you get over to that compassion and understanding, you're really showing your unconscious brain, you didn't deserve to be treated like that, and you can let go of the anger. And so it's really about kind of resolving, feeling to let go and resolving that anger. And I find that often that's the piece, like you're saying, that hasn't been done when people have done emotional work, that maybe they talk about it
Right.
intellectually, or maybe they don't. In fact, maybe they're even taught that they need to fear this, like that it's not safe, that they can't handle it. I often
Right.
find that they
Okay.
need to compartmentalize it. So that can happen too. And then also they're, sometimes they're taught to maybe feel it or express it, like kind of somatic experiencing, like in their body, kind of identify with it, maybe yell out, like feel the emotion. But often I find that it's not wrapped up with that compassion and really resolving it with the compassion piece. And if you're not doing that piece of it, it's not truly really letting it go. And just like you're saying, it takes multiple times of doing this. Like when I did this work myself, the first time I did it, I actually didn't feel my emotions. I was very
Hmm.
intellectual, like, but it took a while to get there, and it took multiple times of doing this to really release and let it go.
Yeah, the emotional work is critical, and there are, it's not that you always necessarily need a mind body physician or coach or something to do emotional work. There are some therapists who've done like really deep training in emotional processing, and it's just worth mentioning
Yeah.
that group of clinicians. Like it goes by experiential dynamic therapy, and some other terms are ISTDP or AEDP, and there's a few other ones that really are about experiencing emotions in the body and doing the somatic work, but also they are good at connecting them with events in our lives and the onset of physical symptoms. And
Yeah.
some of them do it
Yeah.
more than others. And so if you're looking for that, that's out there. And I'll put
Yeah.
some links in the show notes about that.
And the other part is also really looking at personality traits
Yeah.
and personality traits like being high achieving and being hard on ourselves, being a perfectionist, needing control, being people pleasing. Kind of we briefly touched on that, both you and I, raise our hand to all of those. And I mean, nearly 100% of my patients, identify at least
Yeah.
with some of these, and really recognizing where those came from, from our childhood. They were protective and they're helpful in many ways, but our primitive brain takes them to the extreme. And if we're not doing these things to the extreme, which is not reasonable, rationally, or possible often, then it turns that danger part of our brain. So that's the other piece I think that's really important to address too.
That one is I use that more than I would have guessed when I first started coaching with people, as how often they're unaware of just how much pressure they put on themselves all the time, all the
Yeah.
thinking, and just to give them a
Yeah.
label of like, you put a ton of pressure on yourself, like that can cause
Yeah.
chronic pain. How
Yeah.
are we going to lighten up? And sometimes no one's ever quite said that, even if they've been to therapy before. They haven't like
Yeah.
taken a look at this overall personality trait and connected it to their unhappiness and symptoms. They felt like
Yeah.
it served them in achieving a lot, which is maybe true, but it's also
Yes.
there's a way to achieve without constantly bullying yourself.
Right.
And that
Yes.
pain, sometimes you find that the pain is additional, like some kind of an internal bully that punishes them. And so you look at this kind of self-punishing system and you try to get outside of it, and like, how do we introduce more joy? How do we make sure you're not working on the weekend or at nights? And as a treatment program, people love this part too. I feel like this is like a fun part of the mind body treatment. It's
Yeah.
like, oh,
Yeah.
reconnecting with joy, like cutting back on how much I obsessively work and try to pressure
Yeah.
myself into reaching the
Yeah.
next thing. That's a
Yeah.
really joyful part of a mind body treatment. And sometimes that is a missing key that it can unlock a
Yeah.
reduction
Yeah.
in
Oh my
symptoms
gosh.
right away. It
Oh,
happens a
totally for
lot.
me. Yeah, right. Yeah, and again, when we look at what happened with the brain is that we needed unconditional love from our parents. That's what we deserve. But often our brain learns conditions that we get love based on these conditions, based on being a good girl or getting an A or having a clean room or, following religious practices or, whatever it is. And that we need these conditions in order to get our parents' love, and we need to have our
Right.
parents' love in order to get them to take care of us. Because it's kind of a pain to take care of kids being a mother myself. And the primitive brain learns that in order to get our parent to take care of us, we need their love. If we don't have their love, we will die. We can't take care of ourselves by ourselves for a kid. And so if we learn that these conditions give us our parents' love, if we don't have these conditions, we will die. Again, our primitive brain just carries that with us. So that overachieving, being perfectionist, or if our parent is unpredictable, trying to control things as much as we can to bring down that safety, or other people's emotional state is unsafe, if we're attending to their emotional state instead of our own to create a sense of safety for ourselves, that people pleasing is that
Right.
our primitive brain connects those conditions with dying. And so that's what turns up the nervous system. So again, just like you're saying, really recognizing that and starting to see that for what it is so that we can start putting things differences in place.
Let's talk about some how you treat specific symptoms of long COVID that some mind body practitioners may not be as familiar with. Can you talk about how you might work differently with shortness of breath?
With really a lot of different symptoms through the body, it really starts with, the understanding that it's not that there's damage in the body, it's that there is, the signaling in the brain. And so it's I often use the analogy of being afraid of heights. If you fell off a roof and broke both your legs as a kid, and your brain is then interpreting this sensation, this trigger coming in of being at a height, that means danger. It's just reflexive. It puts in the warning signals. So really thinking about it like that is, and then it's sort of exposure therapy that little by little as a process, exposing yourself to a little bit of a height, but coupling it with safe signals over and over and over again can help decrease that. So with shortness of breath, for instance, it's sort of being aware of the sensations, but trying to disconnect the fear with those
Hmm.
sensations and really recognizing that, this isn't a problem in the lungs, that, your x-rays, your CAT scans were normal. Um, this is a common symptom. Really recognizing that there may be sometimes that you don't feel short of breath, even if it's just 5 minutes, to really recognize that you're breathing, your lungs are okay, you're getting enough oxygen. And so really coupling it with safe signals. And the more that you can trigger your senses with safe information, that information tells the brain that we're safe. And by triggering the sensations, it's smells and sights and sounds, taste, touch, and the primitive brain is getting millions of pieces of information at all times and interpreting all that information. Is it danger? Is it safe? Is it danger? Is it safe? So if there's shortness of breath, just the sensations from breathing in that part of the body go to the brain, and the brain just reflexively, that neural pathway stuck in place. Oh, that's not safe. That's dangerous. It has fear around it and puts in those sensations. So the more that you can breathe easy and experience, that sensation going in, coupled with safe signals, the brain gets this one signal and says, "Oh, that's dangerous. I need to protect that." But then if you're smelling something nice or listening to music or you're with a friend or whatever it is, and you're coupling that together, then your brain's like, wait a second, wait, safe signals coming in. Maybe I'm not in as much danger as I think. If you're smiling, because the unconscious brain pays attention to what your conscious brain is doing and responding. Your conscious brain doesn't have direct connection, unfortunately. It can't just get in there and turn it off. But your unconscious brain is paying attention to what your conscious brain is doing. So if you're smiling, you're laughing, you're having a good time, then the unconscious brain says, whoa, well, maybe this isn't as dangerous as I think it is. As opposed to if you're worrying and your face is grimaced and you have a lot of fear and you say, oh my gosh, I can't breathe, and really focusing and fearing the symptoms, then that's just propagating that fear symptom cycle. So you want to break that fear symptom cycle. One of the things also is that actually one of the techniques of calming our nervous system, taking it from fight or flight to rest and digest, is the breath out. That's the part of the breathing that actually physiologically puts our nervous system into the relaxed, calm state of the nervous system. It's actually the breath in that puts us into the fight or flight, and the breath out puts us into the calm state. So even just whatever you're doing, whenever you think about it, breathe out a little bit longer than you breathe in. Um,
I just
and
started breathing out longer right now.
I know it's good, right?
Yeah, it's
So,
good. It feels
so
nice.
as you're doing all of this, often as you pay attention to it, you'll probably find yourself sort of holding your breath a little, breathing in more, but just really focus on breathing out longer than you breathe in. Um, so those are, some of it. The other thing is I find sometimes it can just be too hard to focus on the symptoms and kind of think about the sensations in your body as you're breathing. There's just kind of too much fear there. It's sort of like if you're
Right.
afraid of heights and you start bungee jumping, it's just too much. So then it's really about just really trying to take that focus instead of focusing on the symptoms, just focusing it on joy and laughter. It's very hard for our brain to feel afraid when we are laughing and there's humor and we're experiencing joy. So the more that you can focus on doing those things, the more that it can start creating different neural pathways. And it's hard. I mean, when you're feeling terrible, it's hard to, laugh and experience joy, but it's really important to find just the smallest places that you can do that.
So I would assume the same goes for other symptoms that plague people with long COVID. So brain fog, insomnia, digestive dysfunction, and fatigue. And I think let's just focus on fatigue for a second, because I think that's such a common one, and such a it can affect you so differently than pain and some of the other symptoms, because it just debilitates you and leaves you needing bed rest and things like that. So, yeah, could you talk about how you work with fatigue? And if you're open to this, could you lead us on a sort of guided somatic tracking meditation that will help people start to relate to their fatigue differently?
Yeah, absolutely. This is a big one because it's um, it's much harder to understand what's going on with the fatigue, and it's so profound. Again, just like I could lift up my arm, I just felt like my body was injected with lead. It can be so much harder to really wrap your brain around that this is um, the signals from your brain. And even me, like in this moment when, this morning that I described about my own experience, I knew 100% in my conscious brain that this was, or, my rational brain, intellectual brain, that this was from my nervous system. But even then, in the height of my symptoms, I still questioned it a tiny bit. I mean, not intellectually, but I was like,
Mm.
wow, this is
Yeah.
amazing. This is really just the brain signaling. Because the thing is, I want to just touch on that it is a biochemical change in the body. So
Yeah.
it's not just that we're thinking a thought, it is a biochemical change. There's changes with the ATP, the energy stores being in the wrong place, being used up, all of these different things. It is a biochemical change in the body is happening. Absolutely. It's just that the root of it is from the signaling. So in really understanding fatigue, again, it's biochemical change in the body from the nervous system being stuck in the fight, flight, or freeze. But another way to think about it is in terms of sort of signaling is as pain is a signal, all pain is made from the unconscious brain, 100% of pain, as a warning signal to let our conscious brain know that something in our body needs our attention. If I break my hand, that pain signal lets me know don't use my hand.
Right.
Fatigue is also a signal when we're infected with a virus or a bacteria. That fatigue is a signal to our conscious brain to say, stop working, stop cleaning the house, get in bed, and so that all of your energy stores can go to your immune system to fight the invader so we don't die. But like pain can be a signal that's stuck in place or created when we don't need it. Fatigue is also a signal that then is just stuck in place and um, created when we don't need it. So fatigue is helpful to let us know that we need to rest. If we haven't gotten enough sleep and our sleep deficit is big, then we need to sleep. Or if we ran a marathon, we need to sleep. Or if we're anemic, we need to rest, or whatever it is. But this chronic fatigue that is the warning signal stuck in place because of the nervous system is is not that we need to rest. And I'm sure many people have found that resting and resting and resting doesn't help or doesn't get them there. So, a couple of different parts is sort of, again, thinking psychologically rather than physically in terms of
Right.
dealing with the symptom of fatigue. What's going on for me psychologically that I need to work on? Or do I have, is there a difficult conversation? Is there something that it's hard for me to face? Are, emotions that need to be processed? Am I out of balance? Am I working at night and on weekends too much? All of these different pieces. But the other piece is also my body is not broken. It's it's okay. And so actually by pushing into that fatigue and nudging it a little bit, by coupling it with safe signals, just like with the shortness of breath or pain or whatever it is, that little by little it teaches the brain new information. And so let's do a little bit of a kind of somatic tracking meditation around
Okay.
what that looks like. But the other thing that I find is it's also how you greet the symptoms when they worsen and they come back. That's the most important point. A lot of my patients say, but I do have these periods where I'm feeling better and I am so excited. I really focus on it. I'm positive, I'm hopeful. But then the fatigue comes back and then I'm laid out. I just don't what am I supposed to do? And it's all these different pieces, but the other thing is that they when it comes back they greet it with so much fear
Right.
that that is part of the problem, that they think they're at the bottom of the mountain again, they're never going to get better, and that fear is part of the problem. And it's really understanding, again, it's not the linear trajectory of a sprained ankle, that these chronic symptoms is going on switchbacks up the mountain, and sometimes that switchback actually is going back down the mountain, but you're not at the bottom again. And it's really important when the symptoms come back, say, hello, I've been expecting you. Come in and have a cup of tea before you move on your way again. So that's really important and really understanding that that's just part of the normal process.
Yeah.
So then, how do you address the fatigue symptom? Um, Patients say, well, I can do somatic tracking around pain, like I can focus on pain, but how do I do that with fatigue? But fatigue, there are sensations happening in your body to know that you're fatigued. And so really identifying what those sensations are and really focusing on those, but um, taking away the fear of really attending to them with curiosity and kindness, compassion. So this is the sort of somatic tracking exercise that I do around this. Do you want me to do that?
Yeah, that'd be great. Yeah, if you could lead,
Okay.
you can lead me into somatic tracking.
Okay.
I
Okay.
have fatigue from time to time, I can imagine.
Okay. Perfect. So I'm going to have you close your eyes if you're comfortable doing that, or just gaze down if you don't like closing your eyes. And I want you to first just start focusing on your breathing, if your breathing is an okay sensation for you. If you don't like focusing on breathing, just choose something else, maybe an image or another part of your body that feels good. If you do like focusing on breathing, just take your attention and your awareness and focus it on your breath. And just notice all the sensations around your breath. Maybe the feeling of the air coming in, going out, how it feels on your upper lip. And just allow whatever air in your body wants. And then breathe out just a little bit longer than you breathe in. And as you're breathing out, just melt down your muscles and just relax down into your chair or couch or bed. And then I want you to think about a pleasant place and sensation. I often like thinking about maybe you're a naturalist and your job for the day is to go to a flower-filled meadow and just count the butterflies and just take note of what butterflies are there. You have a pad of paper and a pencil, and your job is to just merely write down the shapes and the colors and the sizes of the butterflies that are flying around you. It's a perfectly warm day. You have your hat on and your sunscreen, so you're not going to get a sunburn. And it's just noticing the butterflies. It's not chasing them away. It's just standing in the middle of them, noticing all their particular interesting characteristics. So now with that same intention, I want you to start looking around your body. And I want you to just start noticing and paying attention to what sensations you're noticing of the fatigue. How does that show up in your body? Sometimes it's a pressure or heaviness in certain parts of your body. Maybe there's a tightness. Sometimes it's even sort of a discomfort, sometimes a kind of aching. And I want you to just look around your body and just take note of where you're noticing those sort of sensations. How do you know that you're fatigued? What signals is your body telling you? Where are you noticing that in your body? Is it in particular parts of your body? And if it's in a particular part of your body, just really look at that and explore. Maybe think about there's, a particular grouping of the butterflies in one corner of that meadow. You're going to walk over to that corner so that you can really see the details and characteristics of that group of butterflies. You're going to look at all the shapes and sizes. Are those sensations something that kind of come and go? Is it constant? Doesn't change at all? Does it pulsate? Does it move and grow? Is it bigger and changing, spreading? Maybe look at the edges of it. Imagine that you're walking around the border of that field and you're noticing, are there butterflies on the other side of that border compared to inside the border? Is that sort of a hazy line or is it a distinct line? And as you look around, just notice with curiosity. I mean, amazement. It is remarkable. This is what our brain does. Just creates all these amazing signals and sensations in our body. I mean, it's a remarkable feat that our brain can do this. And just really, really explore and look at that with amazement and wonderment. That your body is actually healthy. This is your nervous system giving these signals. Just think to yourself, I'm healthy. Hello, brain. Tell your brain I'm safe. I'm okay. And be present with the sensations. The butterflies floating around you. You're just noticing and acknowledging them. And then I want you to bring your attention and your awareness back to your breath. And just notice the sensations of your breathing, how that air feels coming in and going out. Allow your breath in whatever amount of air your body wants to bring in. Breathing out a little bit more than you breathe in. As you breathe out, again, relaxing your body down. Having sort of a smile, maybe inside, smiling with your eyes. And then when you're comfortable and ready, just go ahead and open your eyes. How are you feeling?
Great.
Yeah, how'd that go for you?
That went really well. It was very relaxing. Yeah.
Awesome.
It made me think about how often people will have a reduction in symptoms or increase through a 10-minute somatic tracking exercise, which can also be part of
Yeah,
the diagnostic process if you notice a significant shift.
yeah,
And it's more
right.
more evidence that you have the mind-body factors driving long COVID. Of course,
Yeah,
sometimes people have no change, and that's not proof that there isn't mind-body factors. But
yeah, exactly. And that's the thing is that I think sometimes people think that this exercise is is specifically to get rid of the symptoms. And they
right,
say to me a lot, "Oh, I try to do this, but the symptoms don't leave." No, no, that's not the exercise. The exercise, you don't chase the butterflies away. You stand in the middle and you be present with them and you notice them. And you couple it with safe signals. That's the exercise. By doing that over time, repeatedly, at some point out there, the brain learns that it doesn't need to be sending this signals. And again, that's one piece of the overall comprehensive part of restoring ourselves to good health. And if the symptoms increase, that's great. Just like you're saying, it's moving around. I actually celebrate. I'm like, that's fantastic. I love it when the symptoms increase. If the symptoms stay exactly the same, that's fine too. If they
yeah.
decrease, that's fine. That's okay. But it's anything in there.
Well, this is a really great note to start wrapping things up. Is there anything else you wanted to add before we close out?
You know, there is one other piece I want to add that's a very common one that we mentioned just a little bit, and that's the brain fog component. Because that one can feel
Mm-hmm.
really scary and it's very, very, very common. A couple pieces of it, again, it's very, very common, and it is a normal process of what's going on with the nervous system. And there's Harvard has a Mind Body Institute, and they've studied the chronic stress response for decades and decades and decades, and really shown through functional MRIs that when the danger part of the brain is dialed up, and I describe it as a dimmer switch on a light, the danger is dialed up, the thinking part of the brain, the prefrontal cortex, where we have higher thinking as a human, that part of the brain gets dialed down. Because when we're running from a saber-toothed tiger, we don't need to be doing math. We don't need our higher functioning. We just need the primitive part of just get out of there. So the prefrontal cortex is actually dialed down when the danger part of the brain is turned up, which is why, we're a little spacey. That's where memory is. We can't remember things. We can't concentrate. We're just a little confused even because it is dialed down. Doesn't mean it's broken, does not mean it's damaged. There's information out there. I've had patients come to me saying that specialists, you know, people have told them that it's brain damage. No, 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 it's not.
Yeah.
It is dialing up and dialing down. Yeah, again, like all of it, there's biochemical changes, you know, there's some studies, there's inflammation. Again, it's biochemical changes that is doing all of this, but it's still from the signaling. It's very common, and actually attending to the brain fog with really disconnecting it from fear and really recognizing that as you put in this whole comprehensive plan of these different pieces, little by little, that part gets better. And I see that over and over and over again, not just one or two patients, but over and over and over again. People, not even the people that I work with, but probably that you've worked with, or, other people that use this model around the world also see that part.
Yeah, yeah,
So,
that part, that's really important. I'm glad you mentioned that before we
yeah.
wrap up. Well, Dr. Kennedy, thank you so much for being so generous with your time today. And I found this really illuminating, and I hope it will be a benefit to other people. Everyone, you can find Dr. Kennedy at resilience-healthcare.com. And I can highly recommend her as somebody who's really compassionate, really thoughtful, precise clinician, and does amazing work. So check her out if this is interesting to you. And Dr. Kennedy, thank you for your time today.
Yeah, thank you. I appreciate it, Kent.
Okay, take care. Bye.
You too. Bye.